Hello, this is David with Questor. How do you give a SBAR report? SBAR. SBAR is a simple way for nurses to communicate important patient information. So without turning the report into the patient's entire life story, we use SBAR. SBAR stands for S, situation, B, background, A, assessment, R, recommendation. Think of in this way. What's happening? What do they need to know? What do I think is going on? And what do I need? Let's break it down. S, situation. First, what's happening right now? Identify yourself and the patient. Then get straight to the problem. So you might say, hi, this is Davide, the RN taking care of Mr. Smith in room 204. I'm calling because his blood pressure has dropped to 86/52. That's the situation. Think of it as, why am I calling you? Keep it short. The person receiving the report should understand the immediate concern within the first few sentences. B, background. Next, give the relevant background. And the key word here is relevant. You don't need to tell them everything that has happened since the patient was born. Include information that helps explain the current situation. For example, Mr. Smith is a 72-year-old admitted yesterday with pneumonia. He has a history of hypertension and heart failure, and he received this morning antihypertensive medications. Depending on the situation, relevant background might include diagnosis, reason for admission, important medication, medical history, recent labs or tests, recent procedure. But remember, if it doesn't explain the current problem, you probably don't need it. A, assessment. Now tell them what you are seeing. What did you assess? What are the patient vital signs? Has something changed? For example, his blood pressure is 86/52, his heart rate is 108, the respiratory rate is 22, and his oxygen saturation is 93 on 2 liters of oxygen. He appears more lethargic than he was an hour ago. This is where your nursing assessment becomes important. What do you see? What did you assess? What has changed? And if appropriate, you can communicate what you think may be happening. For example, I'm concerned that this condition is worsening. Remember, you're not just reporting numbers, you're putting the clues together. R, recommendation. Finally, what do you need? This is where many nurses get nervous. But remember, you call for a reason. Be clear about what you need from the provider. You might say, would you like to come evaluate the patient? Or would you like me to hold his next blood pressure medication? Or would you like to order a fluid bolus or any additional labs? The recommendation doesn't mean that you have to know exactly what the provider should order. It means communicating. What needs to happen next? Now let's put all together. Imagine your patient blood pressure suddenly drop. Your SBAR might sound like this. Situation. Hi, this is Davide, the RN taking care of Mr. Smith in room 204. I'm calling because his blood pressure has dropped to 86/52. Background. He is a 72-year-old admitted yesterday with pneumonia. He has a history of hypertension and heart failure and received his morning antihypertensive medication. Assessment. His blood pressure is 86/52, heart rate is 108, respiratory rate is 22, and his oxygen saturation is 93 on 2 liters of oxygen. He's also more lethargic than he was an hour ago. Recommendation. Could you evaluate him? Would you like an additional lab or intervention? And should I hold his antihypertensive medication? That's SBAR. You don't need a complicated speech. Just remember, S, what is happening now? B, what's the relevant history? A, what am I seeing? R, what do I need? SBAR help you take complicated patient situation and turn into a clear conversation. Because good nursing isn't only about knowing what you are seeing, it's also about knowing how to communicate it. This is Davide with Questor, and remember, every nurse starts with a quest.